Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. I was a dentist for 25 years, now doing the dental practice brokers for the last 16. Today's topic is part 2. Banks are shying away from dental office startups. We'll get into that. What was it sunny here in Jersey? Need my glasses. Summertime's coming. Anyway, before we get into that subject, as you know, we have 10 employees. We're in 25 states, and we work every day except Christmas and Easter. Here to serve you. Our phone number is 201-663-0935, and our website is dentalpracticeguide.com or nationwidedentalpracticebrokers.com. So just give us a call. We'll be happy to chat with you. Now, everything you're about to hear is for entertainment purpose, not legal advice. If you have a larger office, you should possibly still think about selling to one of the DSOs. They're still strong and selling, even though some of them have had trouble. We know who the better ones are, who to steer away from. But if you are doing over $1 million, and at least $1 million, over 4 or 5 chairs, you could be a candidate because they're still paying top dollar and they're still buying. Although the percentages have obviously changed, now that the credit market has changed. But anyway, so please give us a call on that. Often they'll pay our commission too, so generally there'll be no commission to you as a seller. And any practice we are representing over $1 million that closes successfully over $1 million will give you reimburse your legal fees, assuming based on certain criteria such as using a qualified dental attorney. Well, we've done this many times. So call us about that. We can tell you about that. All right. So now the second large bank is shying away from dental startups from scratch, no patients, no equipment, just starting up from scratch, no staff. It's getting harder and harder. To build an office is very expensive. Getting staff is very hard. Some offices can't get hygienists. It's tough, and the cost to rebuild an office is like, forget it.
Approaching a railroad crossing.
I've gotten crazy about that. It's just so expensive. So anyway, what's happening is they are trending away because it's a riskier type of procedure to start your own practice. It's one thing to buy a practice because it has a proven track record. It's another to create the problem that you have now. And it's a big problem. Because trying to start from scratch, you'll have no patience, you have no staff, and it's just as difficult to build now as it was 10 years ago, if not more so. The expense has gone up really high. I mean, x-rays used to be $2,000 mounted on the wall are now like $5,800. It's like crazy numbers. You just got to get away from it. And I don't know what's going to happen. But as of right now, the banks are just shying away from the startups, because another doctor just told me about this. I talked about this on a previous tape. There was one bank that was starting to shy away, but now there's more. There's 2 banks, maybe 3 banks. These are dental specific banks, have a high amount of their portfolio in these dental deals, but that's what they're telling me. They don't want these loans. These guys are buying equipment and building an office and have no patients and have no staff. There's no track record. They don't want to take the chance anymore. There's still great many practices out there. As you know, I was traveling and so forth, getting ready for that Japan or Australian trip, and we had like 3 new practices came about us. So that was very exciting. But anyway, so you really should think differently when it comes to starting from scratch. The banks don't want to do it, and it's a risky type of thing now because, I repeat, expensive to do, a lot of delays. You have no staff, you have no patients. It's not easy. It can be done, but it's just not easy. It's not easy to buy an established practice with a game plan, established patients. You're buying goodwill. That's what it is. All right, team. Have a great time out there. Bye now.